Virtual video visits or telemedicine have become much more common due to the COVID pandemic. This has led to many asking, is it possible to have patient-centered care during a virtual video visit? In this introductory module, developed by the Institute for Healthcare Communication, you will learn that effective communication skills are even more critical for successful patient encounters in virtual formats. I'm Dr. Michael Marks, orthopedic surgeon and senior consultant since 2006 with the Institute for Healthcare Communications. And it is my pleasure to be presenting this webinar with my colleague on why communication skills are important during virtual video visits.
Hello, I'm Dr. Donna Phillips, orthopedic surgeon and senior consultant for the Institute for Healthcare Communications since 2005. In this webinar, we will introduce you to the importance of communication skills in your patient interactions. The specific skills will be taught in the modules that follow this webinar. What is the benefit to us as surgeons and clinicians to learn and improve communication skills? Many of you may have had basic communication training, yet these skills are seldom reinforced after graduation. Now, in our virtual environment, connection is achieved primarily through verbal communication. It's time to refresh our skills. Most clinicians gain satisfaction from caring for patients and value the connections they establish. Studies show that good communication decreases burnout in clinicians and improves clinician satisfaction. Despite social distancing, effective communication skills can preserve the connection with your patients. Patient satisfaction is important for both patients and clinicians. Improving your communication skills can also improve your patient experience scores. Good team communication enhances patient safety, decreases adverse outcomes, and improves staff satisfaction. In fact, physicians showing empathy and effective communication have been shown to improve nurses' job satisfaction, resulting in decreased staff turnover and improved team performance. Patient outcomes are impacted by clinician-patient communication, whether face-to-face or virtually. The next few slides will introduce the two premises that guide this work and highlight how patient outcomes are affected by communication. There are two premises that guide this work. First, communication matters regardless of your specialty. As we have pointed out, it matters for clinician satisfaction, patient satisfaction, and patient outcomes. Patients spend 95% of their time with you during virtual video visits. Therefore, your communication skills really matter.
As mentioned, there are a number of outcomes that are improved through effective communication skills. In the next few minutes, we will talk about patient satisfaction, diagnostic accuracy, adherence, patient safety, and finally, malpractice risk. According to Press-Ganey, a firm that has measured patient satisfaction since 1985, a large percentage of variance in patient satisfaction scores, actually up to 70%, is explained by how you as the clinician interact with your patients. Specifically, patients notice if you're attentive or appear interested, whether you take their problems seriously, and if you demonstrate concern. In addition, the variance in satisfaction scores relates to how you share information and whether it's shared in clear, understandable terms. This applies to your virtual video visits as well as in-person visits. Both require you to avoid distractions and focus solely on your patient. Treating the patient with respect is a key factor for patient satisfaction, as shown by a 2013 study of CAP scores across all specialties. The way we communicate with our patients can have a significant impact on diagnostic accuracy. You know from your training that if you listen to your patient, they will tell you the diagnosis. Yet clinicians interrupt patients for a myriad of reasons. Studies over 3 decades show that patients are interrupted within seconds of beginning their story. In face-to-face visits, this is common. And in virtual visits, it is even more likely due to a lack of visual cues and a lag time between speaking and transmission. When you interrupt your patient, you send the signal that your patient's story is unimportant. To put these times into perspective, recall that the average red light is only about 20 to 30 seconds.
This slide shows the results of a 2013 medication adherence study where participants identified multiple reasons for not taking their medication as recommended. A common frustration for clinicians is non-adherence. Most of the reasons for non-adherence identified here can be mitigated by good communication, forming a partnership with your patient, and assessing their understanding and willingness to follow the plan. This does not take longer during your visit. In fact, it's been shown to save time and improve outcomes. Communication matters for patient safety. The breakdown of communication between our healthcare teams and team members has been found to be one of the greatest contributors to serious safety events. The use of clear, complete, and effective communication decreases the incidence of adverse events. Communication skills matter for preventing malpractice claims. When there are communication failures between clinician and patient, the risk of malpractice claims increases. Beckman and Frankel analyzed depositions in malpractice suits and found that communication breakdowns between clinician and patient to be the primary reason for the lawsuit in 71% of cases. They identified 3 themes. Patients felt deserted by their doctor, they felt devalued, or they felt information was delivered poorly. You can imagine that if this occurs during in-person visits, that it may be even more common when you're interacting on a virtual platform. In a digital environment, it is essential that you're a good listener, answer all your patients' questions and concerns, maintain a warm vocal tone, and show respect.
The second premise is that communication is a procedure that can be taught, learned, and improved. We know that communication is an essential clinical skill set, not an add-on social skill, personality trait, or bedside manner. It is a series of learned skills. We also know that experience alone can be a poor teacher. Patient interviews are the most common procedure in your career. In fact, most clinicians will probably have more than 160,000 interactions. During virtual video visits, the history becomes the majority of the visit. Taking a full history, showing empathy, educating the patient, and forming a partnership are essential skills. In 2013, Levinson conducted a systematic review of surgeon-patient communication and noted effective listening and addressing patients' emotions and concerns can be taught just like any other procedure.
In the 4 modules created by the Institute for Healthcare Communication, you will learn how to improve your communication skills with patients during your in-person and virtual video visits. The modules are based on patient-centered care and require the use of 2 important tasks. The first is the biomedical task, which includes diagnosing a patient's problem and then resolving and treating that problem. We refer to these tasks as find it and fix it. These tasks are necessary, yet they're insufficient for optimal patient care. The second set of tasks pertain to our communication with patients. The Institute for Healthcare Communication has developed a model to address communication tasks called the E4 model. This model provides a framework for essential clinical communication skills for enhancing outcomes with your patients. The E4 model includes engage the patient so you can seek to understand the health issue from the patient's perspective. Empathize with the patient to demonstrate caring and respect. Educate the patient using appropriate language and assessing understanding. And finally, enlist the patient to create a partnership through shared decision-making to improve adherence and patient outcomes.
All clinicians experience communication frustrations given the number of interactions we have in the course of a day. Over the past 3 decades, the Institute for Healthcare Communication has conducted thousands of communication workshops where clinicians have shared many of their communication frustrations with us. Some of the frustration examples are a lack of time for addressing a patient with multiple complaints, the patient that has done an internet search and believes Dr. Google rather than you, a patient who appears to be directing their anger at you. These are just a few of the many frustrations and challenges we've heard that impact the quality of the interaction. You may have experienced these frustrations and in fact may have others that you have faced while communicating with your patients. It may be helpful to think about a recent patient encounter where upon reflection, you were aware that you had not developed rapport or met the patient needs. Our goal in the 4 modules that follow this webinar is to identify and demonstrate communication techniques to reduce your frustrations and address your challenges to improve your interactions. We encourage you to visit www.healthcarecom.org or www.karenzupko.com, IHC's educational partner, to learn more and sign up for the CME, CE accredited programs. Again, thank you for your attention, and please go to the Institute for Healthcare Communications website to learn more about improving your communication skills while performing virtual video visits.